Hi, I'm Elie Khoury. I'm an orthopaedic surgeon. I've been practicing for 30 years and I mainly perform knee and hip surgery, complex knee and hip surgery, and also sports medicine. And today, with sports medicine surgery, we're going to talk about ACL reconstruction. And I see a lot of patients that ruptured their anterior cruciate ligaments, or ACL, as we call it and abbreviate it. And mostly these patients are quite young, so they're in their late teens, early 20s, and rupture their cruciate ligament performing twisting sports like football, netball, soccer, less likely court sports like tennis, sometimes skiing, and that's sometimes a bit of a catastrophe, especially if you're young. One of the issues with an anterior cruciate ligament rupture is the fact that people lose stability in their knees, and they describe it as the knee giving way a lot. And that's what people notice with a chronic rupture or a long-term rupture. With an acute rupture, you could have an acutely swollen knee and you need to be carried off the ground. You'll have an MRI scan, it'll be diagnosed, and you'll go to your favorite orthopedic surgeon who'll also diagnose it and recommend some treatments. Most people under 30 who are very active and are still playing sports need surgery. And that surgery will be an ACL reconstruction. You'll also need surgery if you have a meniscal tear associated with it, potentially if it's bad, or another ligament that's torn, like a medial collateral ligament. So all of these things are more conducive to surgery. There are people that don't require surgery, and some people who are a little bit more sedentary, don't play sport, walk in a straight line, a little bit older, over 40 or 50, and these people would probably mostly require conservative management like physiotherapy. Strengthening your quads muscles, hamstrings, and your gluteal muscles can often help you gain control of your knee. So surgery is not necessarily a given if you rupture your anterior cruciate ligament, but it is indicated in certain circumstances. So once we've had the MRI scan done, once we've decided you may or may not need surgery, then we'd embark on a treatment course. If you need surgery, then we would look at a reconstruction procedure, and the reconstruction procedure would involve various grafts, either a hamstring graft these days or a quadriceps graft, sometimes a patella tendon graft, depending on circumstances, patient needs, grafts available, and all of those other issues that come into play. Your surgery would take place in an operating theatre, obviously. Most of it's day surgery. Sometimes you'll be required to stay overnight, and you'd go home the next day and do intensive physiotherapy for 6 weeks. Sometimes other procedures are required with your anterior cruciate ligament reconstruction, like meniscal repair or meniscal suturing, fixing or repairing or reconstructing another ligament, or another reconstruction, depending on your surgeon preferences and depending on your injury. So most patients post-operatively will fully weight bear, attend their physiotherapy for 6 weeks, regain a full range of movement, and in 9 to 12 months return to pivoting sports. And if you have any further questions, please don't hesitate to ask.